Okay, so you're having pain on the outside of your hip. And what you do is you Google it or you look it up here on YouTube probably, and you're wondering what is the problem. And a lot of times the first thing that you will find when you search for pain on the outside of the hip is the word bursitis. And they usually include it, it's included with things like, it'll just say hip bursitis, trochanteric bursitis, hip trochanteric bursitis, greater trochanter bursitis, talking about the bone on the outside of the hip. So in today's video, what I want to talk to you about is if you're having pain on the outside of your hip, is it really a bursitis, or is it a more common thing we find, and this is what the research finds, of a tendinopathy. So we'll kind of go over the anatomy of that, what you should start doing when you're starting to have these symptoms as far as modifying your activity a little bit. And then also, what are some things you can start doing right away as far as treatment, exercises, or rehab to start to help you with this issue, okay? So the first thing that we want to go over is the anatomy of the hip, right? So here is the hip, right? The hip joint here, so we take some of the muscles off of it. You can see the hip joint there. And that little white dot right there is what this anatomy program called the bursa. And you can see a bursa is kind of there on the, right on the outside of the bone, right? I kind of think of it as an internal blister, okay? And there is such a thing as hip bursitis. We'll talk about that, what the symptoms are of that in just a second. And what I want to point out to you is as we add the muscles on here, that you can see how many muscles tie into those spots right around the hip, right along here, right? All your glute muscles and your deep hip muscles all come into the femur, the greater trochanter on there. And it's there where you can where we find that you can get some tendinopathy, which is some irritation of the tendons of the hip that feed into there, which help with rotation, specifically abduction of the hip, which abduction of the hip is the leg swinging out to the side. So when you have actual hip bursitis, what you'll feel, what the symptoms most people feel is pain right on the outside of the hip, right? So just like if you feel like on the outside of your hip where there's like that bony spot, right, where it's really hard, that's where you'll actually feel pain. And probably the symptom that people complain of most is pain with some walking there. And then the thing that really characterizes it is pain with pressure, meaning like if you're sleeping on your side, you'll actually feel it right there over the bone. Okay, and so if you have that condition, that is more of an inflammatory condition where having some rest, some ibuprofen, some ice and things like that will help. And then along with, further along, once the inflammation is gone a little bit, with some of the exercises that we'll be showing you today. But a lot of times what we find and some of the research shows is with people who have pain on the outside of the hip or actually behind that bone a little bit, like back towards their butt, that's more of a hip tendinopathy, where you're actually getting some irritation of the tendons of the hip there. And so, and again, a lot of times people will feel these symptoms with exercise, with walking, with running, with standing on one leg, with going up and down stairs, things like that, where they'll feel that pain kind of not directly on the hip, but they'll feel it more with movement, and it gets irritated with a lot of movement. So the first thing you want to do when you're suspecting this pain as being a tendinopathy, which it most likely is you do want to modify your activity a little bit, right? So avoid some of the things if you're running and walking and things like that. Reduce it just a little bit to get some of the pain to go away, or if there's a specific exercise that you're doing, back off of it just a little bit so to get it to calm down, and then we'll enter into the exercises that we're going to show you now. So let me show you a kind of a series of 4 exercises for kind of like easy, hard, harder progression of exercises you want to do to strengthen around the hip joint, because that is really the key to getting this better. Whether it be the bursitis or the tendinopathy, is work on the muscles that help to stabilize the hip, which will take some of the pressure off the hip joint. But you do have to start easy. So let's go on over here. I'm going to bring my list and let's go through some of these. Dr. Jessica is going to help me. So the first thing that you want to do is do some isometrics. Okay, so Jessica, lay down with your head up there, legs this way. The first one is just like a bridge isometric. So without any band around the legs, I want you to just bridge up. Go ahead, Jessica. And then what she's thinking about is just kind of pushing her knees out a little bit, a little pressure. Don't try to push them as far as you can. And this would be like 30 seconds, even maybe 60-second holds, 3 or 4 rounds. The next one in this easy category would be a kind of a side plank hold, but I call it side planking for your hips. So, and you do it with a short lever arm, meaning that she has her knees bent, so it's just her femur pushing up. So go ahead and push up from there. And when you do this, instead of with a side plank where you're being straight, she's actually, you can see, lifting up a little bit. And there's a lot more pressure here on that side, activation of the hip muscles while she's doing that. She can, again, hold that 30 to 60 seconds. If you want to work both at the same time, you can even like bring a leg up and hold it, and then you'll be working both sides. And again, 3 to 4 rounds, 30 to 60-second hold. So that's where you'd want to start with this. The second round, you want to start by doing some bridges, but this time you're going to do it with a band and you're going to go up and down. So with the band around your knees, she's going to bridge up and sort of like push out as she goes up, right? So, and going up and down. So it's just a little bit of a push out as she moves up and down. So now we're adding a little bit of movement to it. This will be a little bit harder, obviously, than just doing the bridge holds. Again, you can use a fairly light band, and I would do 3 sets of about 15 would be the proper dosage for that. The second one would be the good old-fashioned band walk. So let's keep the band around her knees, and then here, we'll move this pad here. And so with band walks, Jessica will show you the position to get in, just a little knee bend, and then walking sideways, not letting your feet come too close together or getting too far apart, keeping your upper body nice and still. And again, adding some movement to this, going about 30, 45 seconds one way, 30 to 45 seconds the other way. Again, 3 rounds for this is a good place to start. Okay, now we want to start working into some single leg, because most of the stuff that you do as far as running, walking, a lot of exercise is single leg. So go ahead and take the band off. This will be the next progression, is to do a single leg bridge. Yep. All right, so let's do single leg bridge. Go ahead and lie down there again. Single leg bridge, you're just pushing up. Again, this just takes more stability. She's pushing her hips straight up into the air. And again, this just requires more of your hip musculature in order to do this, to stabilize. She'll show us there on both sides what it looks like. Perfect. All right, the next one we want to go into is a single leg Romanian deadlift. This one is, you can start without weight, but it's a pretty easy one to add weight to, just putting a little bit of weight into each side. And with this, you stabilize on one leg and you're pivoting around the hip. So with this, she's working her left hip and she's perfectly pivoting around, meaning she's keeping her back straight while she does it. Go ahead and show us a couple on that right leg, just so they can see that she's really keeping this nice and steady as she pivots around this point. That's the key. Don't reach or bend your back forward. Yeah, you can show some with weight, yep. So you can use 1 or 2 weights and just go down. Good. So again, that requires a lot of hip stability when you're doing it correctly. Okay, and then the last one, the last kind of set is to do some step-ups. Go ahead and show those, Jessica. It's pretty easy. Again, we're just kind of moving into like a more functional pattern as far as hip strengthening goes. If you're far enough along in this progression, you definitely want to add some weight to it at this point. And again, making sure as you step up, the knee's staying nice and stable, not wobbling side to side. You shouldn't feel like the hip, here, let me show you. So you shouldn't feel, when you go to step up, you shouldn't feel like your hip juts out as you load it, right? You should be nice and stable to push up. If you feel like you're doing this, then you're really not strong enough to do it correctly. All right, then the last one are hip articulations. You want me to show this one?
Go ahead, get the
Okay, so hip articulations, you basically get a box or a chair, maybe something about that high. You're working both hips at the same time. It's really a balance exercise. There's 100 different ways for you to do balance exercises, just one that I like. So you stand on one leg, you bring your foot all the way up into hip flexion, and then you bring your knee back over the box and back around, okay? And the key is to see how many you can do without putting your foot down. I don't know, 2 or 3 sometimes is all I get. So, and the nice thing about this one is you're working both hips. This hip's working really hard. I'm not like trying to, to stabilize, stay nice and tall as I move this one around that axis, okay? Again, same with the step ups, maybe doing 10 or 12 each side, 3 rounds. So there's the little progression of hip exercises if you are having lateral hip pain. So if this is something you're experiencing, and especially if you live in the area like around here where we are in Roswell, Georgia, we'd love for you to reach out, or just please comment below with any questions that you might have about having lateral hip pain, and hopefully you can do some of these exercises and start feeling better so you can stay active and keep moving, which is what we want. All right, we'll talk to you guys later.